At American Back Centers, you've got nothing to lose but the pain.
The following program, BackTalk, is sponsored by American Back Centers.
At American Back Centers, you've got nothing to lose but the pain.
Welcome to BackTalk with Dr. Peter Pedduzi, located at 103 Bradford Road, Building 2, Suite 100 in Wexford. Now, with BackTalk, here is Dr. Peter Pedduzi.
Good morning, everyone. This is Dr. Peter Pedduzi with another episode of BackTalk. As we do each and every week, we like to start off our show greeting our new listeners, anyone who's newer to our show, as well as anyone who's listened to our show each and every week. I want to say a special hello to you, and thank you for listening each and every week to BackTalk with myself, Dr. Peter Pedduzi. We're on every Wednesday morning on KHB, 6:20 a.m. from 9 to 10 in the morning. As we start off each and every week, we typically talk about the very unique and wide variety of treatment options we offer here, all under one roof, at the American Back Centers. And we've been doing this for over 40 years now. Dr. Dennis Miskovich started this practice over 40 years ago. And in the last 20 years, we started specializing in the treatment of very difficult disc-related conditions when he purchased and he saw the groundbreaking research, which I talk about each and every week on this show, that was done by Drs. Ramos and Martin and published in the Journal of Neurosurgery back in 1994, and to date is still the only research that sets VAX-D apart from these other so-called decompression traction devices that claim to be the same as VAX-D. Remember, VAX-D is the only FDA-approved disc treatment, non-invasive, non-surgical disc treatment out there that has been proven to work because it actually creates negative pressure, and this was verified through Drs. Ramos and Martin, two neurosurgeons, and published in the Journal of Neurosurgery back in 1994. Of course, Dr. Miskovich saw this and purchased two VAX-D tables and put them in our offices here at the American Back Centers. And since then, we have, without exaggeration, have helped thousands of patients with their disc-related problems, herniated discs, bulging, sciatica, stenosis, those type of issues that are very difficult. And we see some of the most difficult cases. We typically talk about the research, the new things that are going on with VAX-D, answer any questions you may have in the first half hour of the show. The second half hour, we typically talk about a nutrition-related topic or a fitness topic. Last week, we had to run a tape, but 2 weeks ago, we talked about falling is taking a toll on the elderly brains. And we talk about how falls can contribute to fractures and issues with accidents physically, but also we're seeing, we also talk about concussions. We just saw Sidney Crosby, unfortunately, get a concussion in the playoff game the other night. And head injuries can actually occur when you fall, and these are things that are becoming also common. We touched on that among the U.S. adults aged 75 and older. 1 in 45 suffered from a brain injury that led to an emergency room visit due to a fall. And again, this is increasing, unfortunately, so we touched on that. So if you'd like a copy of the article, you can go a couple of different places to get it. Of course, if you don't have a computer or printer, we can send it out to you free of charge. If you have access to the Internet, go on to Macola.com and download the article, or you can go to my Facebook page. We have a Facebook page, American Back Centers Pittsburgh, and you can get it right off the Facebook page. If you have a second, like our Facebook page, and also print off the article. This week we're going to be touching on the cholesterol myth has been busted yet again, especially if you're on a statin drug. If you've been told your cholesterol is too high, you need to go on a statin drug. Listen to what we have to say today. Go on the Facebook page, print it off. If you don't have time to listen to the show today, hopefully you will have time. But if not, at least go and print that off from our Facebook page. Go to Macola.com as well. The cholesterol myth has been busted yet again. Again, our Facebook page is American Back Centers Pittsburgh. Go on the page. You can print it right off. We make it easy. We try to put the health articles, fitness articles that we're going to be talking about on the show on the Facebook page prior to the show if we have time. So you can just go on there. You can look at the page, look at all the other articles we have on there from past episodes of BackTalk, and you can print off whatever you'd like right from the Facebook page, again, American Back Centers Pittsburgh. All right. So good morning. Of course, at the American Back Centers, we are not your typical chiropractic office since 1994. As I mentioned, the American Back Centers has specialized in the treatment of very difficult cases, including those difficult herniated disc, bulging disc, failed back and neck surgery, sciatica, stenosis, and degenerative disc disease. We've seen some of the most difficult cases here. We've seen people with multiple failed back surgeries. A lot of people are going to the surgeons now. The surgeons are telling them, exhaust all your conservative treatment options first. Some of the surgeons want you to get surgery right away. They try to scare you just because you may have a foot drop, neurological deficit, reflex loss, muscle weakness are those categories, as well as a disc extrusion. Or they try to tell you that surgery is your only option in some cases. There's many good surgeons, I will tell you, in this area. I've gone to many seminars, which I've talked about this on the show many times, Cleveland Clinic, California, different parts of the country with different seminars, that surgeons have stood up and told the audience, again, over and over and over, that surgery should be used as a last resort. Exhaust all your conservative treatment options first. To do all the things that you know. And we talk about, pain medication, epidural injections. All of these things are typically symptomatic relief, physical therapy, rehab. We do therapy and rehab here at the office, but as I always say, there's a time and a place for it. And in the initial phases, especially if you've already failed therapy, it hasn't worked for you, it's not helping you. Can't you see that it's not treating your disc directly? Traction, these spinal decompression tables that just stretch the body apart, in many cases increasing as they raise the poundage. It's shown in research that these tables can actually increase the pressure within the disc, which is contraindicated to what you want. See, these people wonder why they spend thousands of dollars on these so-called specialized disc treatment programs. And they're nothing more than traction. They wonder why it's not working for them. We see this all the time with patients that go through these programs with many different names. And a lot of times they try to hide the fact that you call the office and I've said this many times, they won't even tell you what the procedure is. They try to hide the fact of what the procedure is because if you look deeply, you see it's just a glorified traction table. You may as well go out and buy an inversion table because you're not going to get anything more than stretching the back. And in many cases, increasing the pressure within the disc and essentially making the problem worse because you're allowing for progression of the condition. Same thing with pain meds, epidurals, just Band-Aids. In some cases, I'll tell patients in some cases, if you have a minor disc bulge, go ahead and try it if you must. In some cases, the disc condition, if it's mild, will resolve itself through medication, exercise. We've seen that in many cases, especially with the insurance companies now requiring certain things before they'll approve an MRI. And in some cases, if you don't have neurological deficit, you don't have positive tests, orthopedic tests that are common for a disc, you don't have an MRI, you don't have an X-ray showing compression, they want at least, 6 weeks of conservative care. So go ahead and try, the physical therapy, those type of things. And in some cases, the disc problem, if it's mild, will resolve itself. But in many cases, especially if that has not helped you, or if you have a more severe case, that's where the VaxD comes in. And we've helped some of the most severe cases here at the American Back Centers, even if you've had multiple failed back surgery. So don't let a surgeon tell you that surgery is your only option. We've helped many people that were told this over the years. Again, we've been doing this for over 20 years. Of course, we're the area's first and most experienced disc therapy center, disc specialty center per se. And again, VaxD, if you don't know much about VaxD, if you are new to the show, is a time-tested treatment. It's very safe. It's used all over the world, over 300 facilities, hospitals. There's a few hospitals, medical clinics, orthopedic surgeons in private practice use VaxD. Chiropractic physicians and physical therapists, again, using this worldwide. There's approximately 3,000 patients a day being treated with VaxD therapy. This, of course, VaxD standing for vertebral axial decompression. So as I ask you each and every week, if you're out there listening, you yourself are suffering with severe back pain. You've been told you need surgery. You want a second opinion. At least come and see us first. Or you know someone in this situation who has back or even neck pain. We'll talk about the disc issues in the neck here in a few moments, the treatments we have for that. If you're unresponsive to your current treatment, you want to avoid further pain medication, which is destroying your body inside out. Physical therapy not working for you. Pain medication, pain shots, I should say, epidurals. You're going to a pain clinic receiving these, and they're not helping you, just giving you temporary relief, and we all know it's just a Band-Aid. You've gone to a surgeon. They told you, come back and see me when the pain goes away, and you're trying these other conservative treatment options are not working for you, and now you think surgery is your only option. Or you've already had a failed surgery or multiple failed surgeries. Your symptoms are radiating in your hip, your buttocks, your groin, down your legs. They're not getting better. Your legs are feeling weaker, weakness, foot drop, all common symptoms with these type of problems. Whether, again, it's spinal stenosis contributed by a disc problem, degenerative disc disease, bulging, herniation, protrusion, extrusion. We see many of those as well. Just saw one yesterday. Started a patient with a disc extrusion. These type of problems are very difficult to deal with, and we have the experience. We have the best, and again, the only FDA-approved, safe, clinically proven, non-surgical treatment option called VAXD therapy. So again, if you are new to the show, what is VAXD? Again, it was developed for the management of disabling low back pain and radicular pain. These conditions, again, include discs that are herniated, bulged, degenerated, extruded, posterior facet syndrome, degenerative joint disease or arthritis of the spine, sciatica, spinal stenosis, numbness and tingling, as well as failed back surgery cases. We've had people with 2, 3, or 4 or more failed back surgeries that have done well with VAXD. And again, the only way you will know, and we'll tell you how you can schedule a free consultation later on this show, and then we go over your answer. Number one, answer all your questions. We sit down with you. We don't rush you out of the office. We answer all your questions. We do a detailed history, physical exam, as well as neurological, going over your problem in detail. We encourage you bring in your MRI, X-rays, so we can take a look at things and determine if you are a candidate, if we can accept you. If we do accept you as a good candidate for this therapy, without any contraindications, any reason why we would harm you in any way, you have an extremely high success rate, over 92% success rate if we accept you for care. And again, that's with our office, nationally VAXD successful in approximately 75 to 80% of all cases. Some of the more experienced offices, of course, have been doing this a long time, so they know what patients will do good and what patients will not respond well to VAXD. Plus, we've perfected our protocols. Our protocol is unique to our office. Nobody does it exactly like we do it here. We've added modalities. We've done other things to perfect our program. We have a dietary program as well. We have a lot of different things that go into the anti-inflammatory diet and such that go into our program that make our success rate even higher. So over 92% success rate if you're accepted for care. So this breakthrough technology was developed by Dr. Alan Dyer, the former Deputy Minister of Health of Canada, who also pioneered the research on the heart defibrillator. We all know that's a very important life-saving medical device as well. Research to develop the VAXD treatment was conducted over a period of 6 years with the combined efforts of physicians, engineers, and technicians at major hospitals. So, of course, there's over 300 doctors, MDs, orthopedic surgeons, hospitals, chiropractic physicians, physical therapists, dedicated to bringing you long-term relief and avoiding the need for surgery now as well as into the future. Again, don't wait until your condition worsens. Call us today. We do have a toll-free number, 1-888-222-8293. Again, 1-888-222-8293 to schedule your free consultation. You can also visit our webpage and request an appointment right on the website, www.AmericanBackCenters, BACK Centers, plural.com. Visit our webpage. We have a lot of great things on there. You can, of course, request an appointment. We have a patient education and blog section that we try to update each and every week. You can sign up for our daily health update newsletter, which we're very excited to have on there. Each and every day, you get health tips, and you get an inspirational quote for the day as well each and every day when you sign up. So just go to the webpage and sign up for the daily health update emails sent right to your email. You also automatically, free of charge, get signed up for the monthly In Good Hands newsletter. It's sent to you once a month. It's a more detailed, typically about 10-page long health articles, and this is from some of the greatest health people in the country. We talked about Dr. Mike Rosen, Dr. Oz. Different people contribute to this health article, and it's nice, and it's totally free when you sign up for the daily Health Update newsletter. So again, visit our website, sign up for the health newsletter, check out our website, check out all the ins and outs about the treatments, how VaxD works. It gives you a nice explanation of how VaxD works, all the different treatment options we offer here at the American Back Centers. Very comprehensive. We continue to update our website, and there's a lot of great information on there. You can meet myself as well as the other staff, learn a little bit about us, our bios, right on the website. Again, www.americanbackcenters.com. If you have a question, of course, we do have open phone lines, 412-825-6262, 412-825-6262. You can also email me a question at Dr. Pedduzi at AmericanBackCenters.com. Again, Dr. Pedduzi at AmericanBackCenters.com. If you don't know how to spell Pedduzi, it's P as in Paul, E as in Edward, D as in dog, U-Z-Z-I. Also, our office number, local number is 724-935-3300, 724-935-3300. If you have any questions, if you'd like to schedule a free consultation. Also, our fax number. We do encourage people to fax over their MRI, CT, X-ray reports. Again, that's the typewritten report, not the films. You can't fax over films, of course. To our office, especially if you're coming from a great distance, we can take a look. Put your phone number on the top. Tell you if there's any obvious reasons why you could not get to treatment. We can sometimes see that on the MRI report, any contraindications, and we can save you a trip out here. We do have people coming from hours away, out of state, all over the country for our experience, as well as we have the VaxD and, of course, the only FDA-approved, safe, clinically proven, non-surgical disc treatment out there. So, again, our fax number is 724-935-3321 to fax over those reports. Again, 724-935-3321. All right, in addition to the VaxD, we also offer the cervical disc treatments. If you have a disc problem in the neck region, bulging herniation, degenerated disc in the cervical region, even failed neck surgery, you're contemplating neck surgery, give us a call first. We've helped so many people over the years avoid neck surgery, people that have had failed neck surgeries. It makes no sense to me to go back for another one. Did you know that each subsequent procedure has an even lower success rate than the first? So you're already going in with a low success rate. We talk about the lack of success and the possible permanent complications with surgery. When you go in for a second one, when the first one has not failed, or a third one, when the first two have failed, your success rate is even lower. And your rate of possible permanent complication, of course, goes up as well. So it's a no-brainer to me to try something like this that is documented and researched to work. And we have those treatments for the neck, for the disc issues, as well as the VaxD for the lower back and the thoracic spine region. We also offer therapy and rehab, state-of-the-art facilities, individualized programs. So each patient is treated as an individual. No matter, even the VaxD patients, in some cases, have slightly different rehab programs depending on their particular problem. Shoulder, neck, back, knee, foot, ankle. These type of problems, people come in all the time. Ankle sprains, rotator cuff problems, back sprains, neck, whiplash issues. We have rehab programs for all those type of cases. And again, we also look at what you're doing at work, ergonomical instruction, as well as postural issues. We look at the weak areas that are, developed from sitting at a computer all day, forward anterior head carriage, all of these things that come into play. And we just don't treat you and send you home. We're looking at the total picture, nutritionally, as well as what you're doing at work, at home, weak areas that have developed, correcting those problems, stretching the tight muscles that are pulling on the spine, addressing all these issues that come into play. And that's why our success rate is so high. We're looking at the total picture. Wrist, hand, finger, foot, ankle, and knee problems. Examples including tendonitis, rotator cuff, carpal tunnel, as we mentioned, sprains, strains. We even have people coming in with scripts, from their PCPs for therapy. Of course, you can do the therapy right here at our office. We're doing essentially the same thing, but we offer much more. In addition to the therapy, we also offer chiropractic, of course, massage, and nutrition, as well as the specialized treatments for the disc in the neck and the back. So we have a lot to offer here, much more than a standard therapy center. People coming in post-surgical, I should say. I'm having trouble talking today. I'm sorry, guys. I started off bad, and here and there I'm having some issues. Sorry. But, after surgery, many people come in. They have a hip replacement, knee replacement, those type of issues. We can do the rehab for those areas. We have all the standard therapies for that, all the rehab programs, exercise programs that you normally will see at a therapy center. In addition, we also have the massage component, addressing those muscles, those trigger points, the chiropractic, of course, and the specialized treatments. So, which brings us to our massage therapist, deep tissue massage, myofascial trigger point therapy, acupressure, reflexology. We do that here at the American Back Center, so we address those myofascial issues. Comprehensive nutritional consultations. We have a nice symptom survey from Center Process, which we can send to you. If you can't come to our office, you can fill it out at home, or you can pick it up at the office and fill it out here, and we score it, and it gives you a nice comprehensive evaluation of your nutrition. Also, I'm taking a certification course in functional medicine, so I'll be getting into that more in the next couple months, talking more about that and how we can help you even further through nutrition, through functional medicine. So I'll be adding that component to our practice as well. In addition to being a disc specialty practice, we'll be doing what I love as well, which is nutrition and getting people not off the drugs per se, 'cause we do that, but we can encourage people to encourage the people that put them on the drugs to lessen the dosage and get them off in the first place, and looking at the true cause, what's actually causing the problem. That's what functional medicine does. So we'll be getting into that more in the next couple months on BackTalk, so definitely stay tuned for that. So we also have custom-made orthotics. We talk about this 3D digital scanning system we have here. We simply just stand on the scanner, and it gives you a 3D picture of any possible dysfunction in the foot. So we do have that high-tech technology here for scanning the foot, and we're very happy to have that, very proud to have that. And patients love it because they're getting a nice scan of the foot, custom-made orthotic, truly custom-made, whereas you go to some of these places, they say they're custom-made, but yet they go in the back and take one off the shelf. So I question, how is that really custom-made when you're getting something off the shelf the same day? This takes about 5 to 7 business days. It's sent electronically. You're scanned to the company, and they custom-made a orthotic based on your individual problems, if you have problems. Not everyone that gets on the scanner, of course, has problems. But if you do, this makes a true difference in our patients we have seen in their total picture, because again, you're looking from the ground up. A lot of people have issues in the feet, whether it's a heel spur, plantar fallen arch, which can affect all the way up into the neck, as well as the knee, the hip, and the lower back. We also offer acupressure treatment. We have great success, especially now with sinus issues. A lot of people are having allergies and sinus issues, and we can help promote drainage as well as help your allergies. And we have some nutritional recommendations, as well as getting adjusted, of course, helps with allergies as well and sinus issues, especially this time of year. And we all see that allergies are very, seem to be a little bit worse this year with all the pollen counts being high, as well as we're seeing a lot of bugs, which have nothing to do with allergies, but we're seeing a lot of that this year, especially with the mild winter. We have in-house X-ray nerve conduction testing, ultrasound testing done right here at the American Back Centers if you need that. We have a convenient MRI CT facility right across the street from our office, North Pittsburgh Imaging. And finally, I'm a certified personal trainer, so I can help you get back in the gym and do things correctly. As I always talk about, people have good intentions, going back and exercising at the gym. In some cases, end up hurting themselves because, I hate to say it, but they don't know what they're doing, and they end up trying to lift too much weight or do things incorrectly, and they end up hurting themselves. So we can help you with that as well, being a doctor as well as a certified personal trainer. Finally, when we talk about VAC-C, again, our protocol is physician-directed. Our protocol is unique. Our protocol engages other modalities as needed on a case-by-case basis. We have over 20 years of experience now treating people with this therapy, and we screen out and decline candidates whose medical records and evaluation indicate we are unlikely to help them. So if we can't help you, of course, we will tell you, and we'll refer you out to the appropriate specialist. So again, VAX-D stands for vertebral axillary decompression. It relieves pressure on vital structures of the spine, including your disc as well as your spinal nerve. So it's taking that pressure off that nerve, whether it's sciatica, whether it's the disc being pushed out onto the nerve of the spinal cord in some cases, the disc being pushed out contributing to your spinal stenosis. We can help pull that back out of there and relieve that inflammation in your pain and suffering, your numbness and tingling, your weakness, all attributed to, in many cases, the spinal nerves being occluded or impinged upon. Does not just treat the symptoms. It's actually structurally opening up, and that's very important. In most cases, the problem is compression of the spine, leading to arthritis, leading to bulging disc, herniated disc, pushing on the nerves, causing your pain, your numbness, your tingling, your weakness. So it's structurally treating the problem, not just symptomatic. It's not like the epidurals or the pain meds, symptomatic relief. It alleviates the underlying problem that causes your low back pain. Non-surgical, it's a patented procedure, it's FDA approved, and it's endorsed by the Assistant Surgeon General of the U.S., Dr. Robert Chaney, as well as many, many doctors, as medical doctors, orthopedic surgeons, chiropractic physicians, physical therapists using VAX-D, many professional athletes, NBA, NHL, NFL, Olympic athletes. We even had a actor. We told you that a couple years ago. He was here filming a movie because he saw the success with VAX-D. He wanted to finish his program here in Pittsburgh when he was filming the movie and finish off his VAX-D program here, and he did exceptionally well, despite the fact that his role in the movie was physically demanding. He was a boxing trainer in the movie, and he had to do a lot of physical activity in the movie, and he still did well despite that. The VAX-D table and its computer work with each individual patient, adjusting back tension, which in turn adjusts interdiscal pressure moment by moment. The computer adjusts the tension in small amounts as the muscles in lower back do not spasm or contract during treatment, which allows decompression to take place. So that's what makes, again, one of the things that makes VAX-D unique and unlike these so-called decompression tables. Also, it's a very high-tech computer, which we just mentioned, which never allows for the paraspinal muscles to contract, which is extremely important, and which is unique to VAX-D to allow for the true separation of those compressed discs. And it's very important to note. Relief of acute or chronic back pain and associated leg pain or numbness is generally within 1 month of treatment. It's successful in over 70% of patients. Our office, we're over 92% if we accept you for care. Early return to work, it's covered by workers' comp as well as auto insurance companies, as well as many insurance companies in PA, fully covers VAX-D therapy, non-invasive and safe, no patient hospitalization whatsoever, and it's a very comfortable treatment. Many people even fall asleep on the procedure because it is a comfortable procedure. In some cases, in the beginning, when your disc is inflamed, you may have a little bit of discomfort as we start to pull the hot disc back into place. But typically, when you get to that immediate first couple treatments, the treatment is very comfortable and very relaxing. No needles, no anesthesia, no incisions. It relieves pressure on the lumbar spine. Pain relief is possible during your first treatment. It's clinically proven, FDA approved. And again, the therapy is performed in a comfortable, non-surgical setting. So we do offer a free consultation, no cost or obligation, to see if you would be a candidate for VAX-D, for the cervical disc treatment, or any of the other treatment options we mentioned today. Call us today, again, toll-free 1-888-222-8293 or 724-935-3300. Or you can go to our webpage, www.americanbackcenters.com, and request an appointment right on the webpage. Again, www.americanbackcenters.com. We sit down with you, answer all your questions. We take your time with you. We encourage you, bring somebody in with you when you come in for your consultation. Number one, to drive you out here. Of course, you're in pain. You shouldn't have to drive out here by yourself if you're in pain. If you don't have someone, that's obviously perfectly fine, but we do encourage you to bring a family member, a spouse, a neighbor with you. It just helps with the whole process, answering all your questions. If you have somebody else here with you, especially if you're in pain, we do a detailed history, physical exam. We encourage you, bring in your x-rays, bring in your MRIs if you have them, CT scans. That just gives us a better idea if you'd be a candidate for the therapy. And we can make a better interpretation as well as more an accurate decision if you would do well with this therapy. And again, if we do accept you, again, we've been doing this for over 20 years, so we like to think we know what we're doing. We have an over 92% success rate if accepted for care. Also, we offer that free DVD. It's when Channel 11 did a medical breakthroughs report. Channel 11 put us on the news and did a medical breakthroughs report. This is on a DVD. You can see this. Just call us. We can send you the DVD free of charge, as well as a 24-page color booklet describing all the ins and outs of VaxD. It's a nice booklet. It's free. Just call us today and ask for the DVD as well as the booklet. We can send it to you free of charge. We also have those research papers. The first paper is published in the Canadian Journal of Clinical Medicine. This research was done right here on the on VaxD at the American Back Centers. We also have the Knife in the Back article we sent out to you for many, many years. We've been doing this, showing the failures of back surgery and why surgery, specifically fusion surgery, is not the best approach for chronic back pain. We all know this, but they continue to push them because we all know it's a money-making procedure for the hospitals, fusion surgeries, as well as doctors. And they make tremendous thousands and thousands of dollars off these procedures, and they're putting rods and screws in your back. And we talk about the dangers with that, of course, of possible permanent complications. When they fuse a segment, that takes care of the compression, unlike the other surgeries. But the problem is the area is not moving. It's meant to move. The areas above and below have to compensate. So it's only a matter of time. So I love when these back surgeons, especially these laser surgeons, claim 96% success rate. And all these people claim all these 98% success rate. What is success? Well, we always say that. And with VaxD, when we say 92% success rate, we mean 4 years more and more. You're going to not have pain. You're not going to have pain ever again in some cases, if not all cases. It's a permanent correction. Whereas when they say 98% success rate, you could have success for a week, a month, a year, 2 years, but then when that pain comes back again, and it will in most cases, how is that successful? We talk about how they snip off a piece of the disc with the laser, tremendous out-of-pocket expense with the laser spinal surgery, $20,000 to $40,000 out-of-pocket expense for this procedure that most surgeons will tell you is not as precise. They would rather use their hand and their scalpel because it's more accurate. They know how deep they're going in, the depth of penetration. It's more precise. And even with both procedures, either the laser, which is costing you a tremendous out-of-pocket expense because it's not covered by insurance, or the standard discectomy, they're just snipping off a piece of the disc. The compression issue, I stress this over and over and over, is not being addressed. With VaxD, we address the compression issue. So those bone spurs, that disc space does not continue to diminish in height. The disc does not continue to be compressed. And that arthritis, those bone spurs, as I just mentioned, does not continue to get worse. And that's why you got to go back in for another surgery, because now you have those problems after they snip out the disc, and then they want to fuse the spine. That takes care of the compression. We just mentioned how now the areas above and below have to compensate for that fusion, and then you end up having problems, and guess what? Another surgery. We see that's oh so common with people coming in our office with these failed back surgeries. I wish we would have seen them before this, but we still can help you in many cases, even if you're in those cases where you've had multiple failed back surgeries, even a fusion surgery, as long as your whole back is not fused. All right, so again, schedule a free consultation, no cost or obligation. You can also receive the DVD, Channel 11's DVD, when they did a report on our office, the research papers, the 24-page color booklet showing the ins and outs of VaxD, free of charge. Just call our office, 724-935-3300. I'm going to give you a quick few testimonials, and the first one is from a truck driver who received VaxD. He goes on to say, before I received these treatments, I had lower back pain and severe sciatic nerve pain. I had trouble walking for 9 weeks. I went to a chiropractor. I went to a physical therapist, and I also went to an orthopedist. I finally found VaxD because these other treatments did not help me. After these other treatments did not help me, I finally found VaxD. After 2 treatments, I started feeling better. I had no pain. I could walk. I could stand without any pain. My life has changed by having no pain and not worrying about having surgery. The VaxD treatment is a better way to go than surgery. It's painless, and it has less downtime. The treatment makes you feel better each time you have one. Another quick consultation, or I should say another quick testimonial is from a computer consultant. He goes on to state, I'd suffered with stabbing pain in my lower back on and off for years. I had tried chiropractic care, which alleviated some of my pain, but not eliminated it. I decided to try Vaxi to try something different. This could result in a permanent cure. After the first week, I started feeling better. I have much less pain in my lower back, and I can lift more weight and be more active without experiencing any pain at all. I would definitely tell anyone with similar or the same condition to try Vaxi. And finally, we have a patient, Linda, goes on to state, before Vaxi, I had spent 6 months in a back brace, and I needed special clothes for. I had a lot of difficulty walking because of my back pain, and as a result, I had to give up a lot of activities. I was told by my physician that the only option that I had was to get rid of my back pain was surgery. Then I started Vaxi treatments at a Vaxi center. I had 20 sessions for about a month, following all their instructions religiously in order to get the best results of my procedure. I'm happy to say it's been over a year since I completed Vaxi. My back pain is gone. I feel like a normal person. I can now walk my dog, get up after a train ride, as well as get out of bed every morning without any pain. Even with these results, I remain realistic in that I know I am no longer 20 years old and I cannot partake in everything I once did. Nevertheless, Vaxi has taken away the fear that I once had of performing my everyday activities. Simply put, it gave my life back. So just a couple quick testimonials I want to give you on patients that, of course, were successful with Vaxi therapy. And we've seen literally hundreds, if not thousands, of patients ourselves just right here at the American Back Centers here in Wexford over the last 20 years. So many great success stories helping people. It's one of the reasons why I love coming to work every day is just seeing these changes in these people's lives where they had no hope. They thought that surgery was their only option. They already had failed back surgery or failed neck surgery in the case of the cervical treatments, and they thought that there was no hope for them. And they thought their life was just going to be continued pain and disability. And in many cases, we've helped people get out of wheelchairs. We've helped people get rid of their canes, their walkers, and severe pain and disability. And now they're back without pain, and they're able to live a life again, enjoying their children, their grandchildren, enjoying their work, their life without suffering and severe pain, without having to take all these prescription pain pills, all these steroids, all these things that are just damaging their body. Again, I tell patients, short term, you can try these things. Short term, I'm okay with it. The long term, that's where you're going to have the problems. You're going to destroy your body with these symptomatic pain pills, narcotics, all these things that you're putting in your body that are just putting a Band-Aid on the problem and not really addressing the true cause. And that's what Vaxi does. It actually addresses the structural cause of the problem. So again, the real question should be, why would you even think about surgery with all its complications and lack of success, not including the normal risks that we see with all surgeries, infection, bleeding, blood clots, when Vaxi is an option? Vaxi is a non-invasive, safe treatment with a much, much higher success rate than surgery, pain injections, or physical therapy. Many patients go this route and eventually end up at our office wishing they would have come to us much sooner. Remember, Vaxi addresses the true cause of the problem, decompressing the disc, restoring the fluid and oxygen content to that degenerated disc, taking the compression off the spine and the disc, relieving your pain associated with low back pain, disc problems, herniated, degenerated, extruded, bulged, protruded, sciatica, stenosis, numbness and tingling, and even failed back surgery cases. So give us a call today, 724-935-3300, or toll-free 1-888-222-8293. Again, 1-888-222-8293, or visit our website to request an appointment, www.americanbackcenters.com. Quickly, as I like to highlight some of our supplements that we have at our office, we're going to be talking about statin drugs today and cholesterol, so I'll highlight the Pro Omega CoQ10. It's a great product because it saves you money. It has a concentrated EPA DHA fish oil with a therapeutic dose of CoQ10 in one pill. So you're saving yourself money because it's all together. So you're getting the CoQ10 plus the high-dose fish oil together in one pill. So if you'd like to try the Pro Omega CoQ10, call our office. We can send it to you for a small shipping fee, or you can pick it up and save the shipping fees. We have a great product for carpal tunnel. We've seen great success with this, B6, B1 plus zinc. It's the B6 in the appropriate active form, which we've seen better success with than the standard B6 for carpal tunnel, with B1 as well as zinc, working together synergistically for optimal results for carpal tunnel and any type of neuropathy syndrome. We're seeing good success with that as well. Of course, when a patient has carpal tunnel, of course, we're looking at their spine, looking to see if there's any issues in their wrist, arm, that we adjust those areas as well as the neck. We have some cervical treatments to open up the holes, the foramen, that impact the nerves. So we have that option, as well as we have therapy and rehab that we offer here at our office, addressing those issues as well. So, as well as the massage and the myofascial component. So we're looking at all avenues, as well as we have the supplementation as well. We also have the new product for testosterone. It's not testosterone, but it's natural precursors, botanical formula that naturally produces testosterone. So we have that as well. Clinically proven testosterone precursors is a natural formula, so it's not running the risk of taking testosterone. We talked about that a few weeks ago, how taking testosterone could have some risk and problems. This actually naturally stimulates the production of testosterone in the body, and it's completely safe and natural. So if you'd like to try this product, call our office, and we can send it to you, again, for a small shipping fee, or you can pick it up and save the shipping. We also have a salivary take-home test kit. You purchase the kit. It includes your testing at the lab, as well as the postage involved with it, and, of course, the test kit. And it's a small fee. I think it's only $30. It's very inexpensive, and you can do it at home. And then you can see, once you get the lab test back, if your T score, your testosterone score, is low. If it is low, then I would definitely recommend you try our product, such as the natural solution to a natural problem that we have here, herbal botanical extracts known to support production. Progene is the name of the product, and you can try it. Again, call our office. We can send it to you, or you can pick it up right here at the American Back Centers. All right, we're going to get into the nutritional segment today. If we do have time, we'll go over some of the other supplements I wanted to highlight, but I want to skip forward. I want to get into the nutritional article today because I think it's important. Last week, or 2 weeks ago when we were live, we talked about the importance of being careful with falling and concussions that are occurring, brain injuries that were occurring when older people, elderly people fall, and it's actually very traumatic to their brains. And we talk about Sidney Crosby with the concussion, but when you fall, you got to be careful. If you're falling, especially if you're older, you can suffer a brain injury. So we touched on that last week. This week we're going to be touching on the cholesterol myth, and has been busted yet again. And he goes on to talk about, this is from McCullough.com, a 40-year-old previously unpublished trial shows that while replacing saturated fats with vegetable oil lowered total cholesterol by 14%. For every 30-point drop in total cholesterol, there was a 22% increase in chance of death. Many other trials have also found that replacing saturated fats with vegetable oils increased mortality risks from all causes, including coronary heart disease and cardiovascular disease. So these processed vegetable oils contribute to attacks, devastating attacks to your health and attacks to your brain in several ways, thereby contributing to and worsening neurological disorder. So as we get into the heart of the article, this is from, again, McCullough.com, MERCOLA.com. For the past 4 decades, the U.S. government has warned that eating cholesterol-rich foods such as eggs could raise your bad cholesterol, your LDL cholesterol, and promote heart disease. And he goes on to state inappropriate referred to as bad cholesterol. Alas, decades' worth of research utterly failed to demonstrate this correlation. In the 2015-2020 dietary guidelines for Americans finally addressed the scientific shortcoming, announcing, quote, cholesterol is not considered a nutrient of concern for overconsumption. This is good news, since dietary cholesterol plays an important role in brain health and memory formation. It is indispensable for the building of cells and production of stress and sex hormones, as well as vitamin D. When the sunlight strikes your bare skin, cholesterol in your skin is converted to vitamin D. Unfortunately, The dietary guidelines still cling to outdated misinformation about saturated fat, wrongly accusing it of raising LDL and contributing to heart disease. Here, science has shown that saturated fat only raises the safe, fluffy LDL particles. Again, the safe, fluffy LDL particles. It also increases HDL, the good cholesterol, if you want to call it that, which is beneficial for your heart. The guidelines are still confusing because the basic premises was wrong, he goes on to state. Dietary fat is indeed associated with heart disease, but it's processed vegetable oils, which are loaded with trans fats and oxidated omega-6 fats, remember we've talked about that many times on this show, that are the problem, not the saturated fats. The introduction of high-processed and frequent heated omega-6 vegetable oils distorted the vitally important omega-6 to 3 ratio, causing metabolic catastrophes. The problem was further exacerbated by replacing saturated fat with refined carbohydrates, which were incorrectly viewed as a healthier option, thanks to the misinformation created and spread by the sugar industry. Next paragraph, impairs electrical storage potential of your cells. Goes on to state nutrition and biochemistry are clearly important to your health, but so is your body's electrical system. All of our membranes are made of fats that are insulators and connected through a conductor. This arrangement sets up a biological capacitor to store electrons, but only the fats are healthy. If you consume damaged fats, or worse, heated or hydrogenated fats or oils, the fatty acids in the cell membranes essentially become non-functional and unable to store body voltage, thus increasing the risk for disease. This is one of the many reasons why it's vital to eat healthy fats. Next paragraph. Ansel Keys was one of the most prominent nutritional researchers in the mid-20th century. He gained enormous professional and influential prominence, and his views were widely accepted by professional and public health organizations. He goes on to talk about how some of his follow-up research actually undermined his hypothesis on cholesterol and saturated fat, but these findings were never published. Had they been, the cholesterol and low-fat myths might have gained the same kind of traction. As we skip on down, Keys, who is largely funded by the sugar industry, is believed to have been responsible for suppressing this damning study, as it doesn't support his original hypothesis. Only parts of the trial's research were even published, leaving out the controversial findings that replacing saturated fats with vegetable oils had no benefit on mortality. As reported in Scientific America, goes on to state, the National Institutes of Health unearthed raw data from a 40-year study which challenges the dogma that eating vegetable fats instead of animal fats is good for your heart. The study, the largest gold standard experiment testing that idea, found the opposite. Although the study is more than just another entry in the long-running nutritional wars, it is more rigorous than the vast majority of research on the topic. He goes on to state, he makes no claims that it settles the question. Instead, he said his discovery and analysis of long-lost data underlie how the failure to publish the results of clinical trials can undermine the truth. So next paragraph, saturated fat vindicated in the largest, most vigorous trial of its kind. This study conducted from 1968 to 1973 included 9,000 plus participants between the ages of 20 and 97, making it the largest trial of its kind. As we skip on down, it goes on to state, on the average, each patient was followed for 15 months. The participants were randomly assigned to 1 to 2 groups, receiving either, number 1, a then standard diet consisting of 18.5% saturated fat from animal fats such as milk, cheese, beef, and shortening, and 5% unsaturated fat based on total calories. The second group diet was based on 50% of saturated fat, were replaced with vegetable oils, the mainstay of today's processed foods, corn oil, and margarine. After analyzing the data, the researcher and his team found that the vegetable oils lowered total cholesterol by an average of 14% after 1 year. However, this lowered cholesterol did not result in improved health and longevity, which is a conventional belief. Instead, the research showed that it lowered the cholesterol but with a higher risk of dying. For every 30% drop in total cholesterol, there was a 22% increased chance of death. In 65 and older category, those who received vegetable oil experienced roughly 15% more deaths compared to seniors in the saturated fat group. The vegetable oil group also did not result in fewer cases of clogging the arteries or heart attacks. On the contrary, autopsies revealed both groups had similar levels of arterial plaque, but 41% of the vegetable oil group showed signs of at least one heart attack compared to 22% of those in the saturated fat group. So as we skip on down, why vegetable oils are so bad for your health? It goes on to say, as we skip on down, they promote gut inflammation and leaky gut. This inflammation can cause heartburn, which can serve as a red flag. Unfortunately, many are misinformed about heartburn to spicy foods rather than the most significant culprit, namely vegetable oils. So this heartburn can actually be attributed to gut inflammation, leaky gut, namely due to the vegetable oils you may be ingesting, disrupting the regulation of blood flow through the arteries in your brain and depleting your brain of antioxidants. This is all things that vegetable oils can do, and that's why they're bad for your health. Turning your immune system against you by affecting your white blood cells, your immune system cells, and causing disease and nerve degenerating reactions. Attacking the nerve cellular architecture, vegetable oils can cause an overload of oxidative reactions inside the cells, leading to accumulation of intercellular trash, also impairing brain formation or brain development through mutagenic effects on DNA, as well as altered expression of the genes. Other reasons why vegetable oils can cause heart disease and other health problems include the following. It increases your omega-6 polyunsaturated levels when taken in large amounts, cannot be burned for fuel. Vegetable oils can be made from genetically engineered crops, which have additional health risk, as we all know, tend to be loaded with toxic herbicide, such as Roundup. While the body needs omega-6, most of us get far too much of it compared to omega-3. This lopsided ratio, which we've talked about on this show many times, can have a adverse health consequence. When heated, vegetable oils tend to oxidize. The oxidized cholesterol is the real culprit, which causes heart disease. By triggering inflammation, we talk about chronic inflammation. We talk about the anti-inflammatory diet all the time on this show. It promotes the clogging of arteries and associated cardiovascular problems, including heart attacks. So again, many studies have debunked the saturated fat myth. I don't have time to go over all of them, but you can see it if you copy this article, if we send it out to you, or if you go to the Facebook page, print it out. Either or, there's quite a few articles debunking this. Next paragraph, statins revisited. We talk about statin drugs. The cholesterol myth has been a boon in the pharmaceutical industry, as cholesterol-lowering statins, also often prescribed as a primary prevention against heart attacks and stroke related to high cholesterol, have become one of the most frequently used drugs on the market. In 2012, nearly 28% of American adults over the age of 40 reported using a statin. So we talk about the dangers, we talk about the over-prescription of these statin drugs. He talks about it even further. What's worse is the guideline also removed the recommendation to use the lowest drug dose possible and said the sole focus is statin-only treatment at higher doses. So we're seeing even more people being put on statins because they lowered the dose possible, and they also lowered the cholesterol recommendation for being put on a statin drug as well. This means you could potentially have an LDL level of 190, but still be at low risk as long as your LDL are large. Your HDL to total cholesterol ratio is above 24%. As mentioned earlier, saturated fat not only increases your HDL, but also increases the large, fluffy LDL, which is what you want. There is actually a good LDL. The large, fluffy one is what you want. It's the other one that you don't want, and the lipids, which we'll talk about as well. So two leading cholesterol guidelines differ in the recommendations. There's conflicting information trying to convince you to go on the statin drugs, and you see the commercials over and over on TV promoting statin drugs over and over. There's proof. We only have about 5 minutes, so I'm just skipping down here. We can continue on this next week. Statin drugs do not reduce mortality, can seriously affect your health. We know this. Increased risk of diabetes has been proven. acute liver disease, muscle pain, tenderness and weakness, side effects, acute kidney failure, patients on statin drugs, chronic liver dysfunction. The list goes on and on. Reduce ketone production, deplete your body of essential vitamins. We talked about CoQ10, vitamin K2, which are important for cardiovascular and heart health. Impaired fertility, reduced sex drive has been seen on statin drugs, nerve damage, increased risk of cancer, dizziness, headaches. The list just goes on and on. It's horrible. So we touch on over and over the importance of CoQ10. Dr. McCullough talks about as well. Anybody who's on a statin drug should be taking CoQ10. What's the important thing? We'll touch on this more next week, too, if we have time, is your HDL cholesterol ratio, not the total cholesterol. The HDL, the good cholesterol, the total cholesterol, is a very potent heart disease risk factor, the HDL percentage. So if it's high, that's good. So you want to divide your HDL level by your total cholesterol. The percentage should be above 24%. Your triglyceride level to HDL ratio, also important, because those tris, those being high, are very dangerous. This percentage should be below 2. The NMR lipo profile, we'll touch on that more next week. Your fasting insulin level, your fasting blood sugar level, as well as your iron level are all important factors a lot of PCPs miss. So we'll definitely touch on that because we are short on time next week as well. So if you'd like a sneak peek, of course, go to McCullough.com and print it off. If you don't have a computer or printer, we can send it to you free of charge. We can go to our Facebook page. Of course, like our page when you're there. You can also send us a friend request if you'd like and print off. The article we touched on today, we'll finish it off next week. We'll have another health article we'll be touching on next week as well. So we are short on time, so we're going to leave you some final closing thoughts as we do each and every week. Again, why would you even consider surgery when vaccine is available? Please be smart. Remember, surgery is a permanent procedure with possible permanent complications, including infection, bleeding, blood clots, scar tissue, and advanced degeneration. The simple fact that a spinal surgery is not successful. A smart, educated person who listens to this radio station and show knows this and will usually make the right choice for their health. I want to thank everyone for listening today. We'll be on next Wednesday and every Wednesday with another episode of Back Talk. This is Dr. Peter Pedduzi. Have a good week. Bye-bye.
You've been listening to Back Talk with Dr. Peter Pedduzi, sponsored by American Back Center, 103 Bradford Road, Building 2, Suite 100 in Wexford. For more information or to contact Dr. Pedduzi for an appointment, call 724-935-3300 or toll free 888-222-8293. That's 888-222-8293. And join us again for Back Talk with Dr. Peter Pedduzi.
At American Back Centers, you've got nothing to lose but the pain.